Polycystic ovary syndrome, PCOS, is one of the most common endocrine disorders in women who are old enough to get pregnant. Each year, it affects nearly 5 million women, and the rates have been rising over the past decade. Doctors have long understood that PCOS is linked with unexplained weight gain, though it is often thought of as mainly a side effect for those who already have the disease. Some research shows, however, that weight gain may also be a factor in the development of the disease for some women. Facts about polycystic ovary syndrome, PCOS, as a disorder of the endocrine system. PCOS affects the functions of the body involved in sending messages between cells and organs. This messaging happens via hormones secreted by endocrine glands like the ovaries. In addition to producing the eggs that eventually can be fertilized by sperm in the uterus, the ovaries are one of the body's major producers of the hormones estrogen and progesterone. Estrogen and progesterone are both involved in promoting the growth of egg follicles and preparing the body for Also alternatively known as polycystic ovarian syndrome, PCOS is so named because of small, fluid-filled cysts that sometimes form on the ovaries. Interestingly, the cysts don't need to have formed in order to diagnose the condition, but it does occur for a majority of patients. It is most common for women to learn that they have PCOS while in their 20s or 30s, but it can actually happen anytime after puberty. The majority of women don't know they even have the condition until they encounter difficulties in trying to get pregnant. Symptoms of PCOS. Even though PCOS is one of the leading causes of infertility in women, it is often difficult to diagnose earlier because it doesn't always cause symptoms. When symptoms are present, however, the most common example is having irregular periods or no periods at all. The rise in androgen levels has also been known to cause a variety of other symptoms in some cases. Cysts on the ovaries, enlargement of the ovaries, excess hair growth on the chest and back, hirsutism, hair thinning on the scalp, acne or oily skin, dark, patchy skin on the back of the neck or under. The underlying cause of PCOS is not fully understood, but the main mechanism is a hormonal imbalance that can temporarily prevent pregnancy. This is thought to be mostly due to the overproduction of androgen, a male hormone that primarily regulates the development of male characteristics. Though women generally have lower androgen levels, the hormone is also important in triggering the onset of puberty in females. When androgen production is increased, the menstrual cycle can be disrupted as ovulation is inhibited. What leads to this increase in androgen levels in some women is also still unclear, but it appears to be partly explained by genetics. Recent research also shows that it might be related to the level of insulin, a different endocrine hormone that regulates metabolism and blood sugar levels. Insulin is released in the bloodstream when blood sugar, glucose, goes up after eating food. The insulin allows the glucose to actually be used by cells to perform their functions. Thanks for watching. Please subscribe.